hospital doctors that come out and work in the pre-hospital environment they've never worked in before.
Right.
And so we have to make sure that they're safe to perform the skills that they need to perform. And so we start off very gently with some simulations and some other things with low stress environment that are very straightforward. And over a period of 3 weeks, we build up that momentum to have a little bit more exposure to stress. We'll have family members be on scene, we'll have noise in the background, we'll have distractions that provides an extra layer of stress to that, so that we're building on the foundations of their skills, but also providing them with what's called stress inoculation. Getting them to experience their heart rate being high and the clammy hands and the fine tremor that comes with the sympathetic activation of their nervous system, to cope with that and manage that whilst performing in a high stakes environment. One of the things that we do in one of the final simulations, we have a patient that's pregnant that has had a major blunt injury to their chest and abdomen, and they need to do a resuscitative hysterotomy as part of the process, which means they have to deliver a baby on scene. So one of the instructors will walk past in an inflatable dinosaur costume, and we'll ask them afterwards whether they noticed anything unusual about the scene, and almost none of the clinicians at that level will notice that a dinosaur walks through the scene. Whereas if you put a very experienced clinician into that role, because they have often a broader experience in situational awareness, they'll notice that there's a dinosaur walk through. It won't put them off their game. They'll continue to be able to perform at a high level, and they'll also be able to tell to it afterwards. Okay, that was a bit weird. I don't have to do anything about it. It didn't cause me any disruption to what I was doing. I just let the dinosaur walk through, and I continued on doing what I was doing.